Hello and welcome to our channel. Mixed methods research are in vogue in public health these days. And somewhere the usability of mixed method research comes from the fact that these provide quite comprehensive evidence. And comprehensive means you get some quantitative data to pitch to policymakers, convince them with real numbers and statistical tests, and qualitative data to add richness into some nuance into the findings that you come up with, and very convincing, compelling storytelling. Mixed methods research also helps in exploring very complex public health issues. So most of the public health challenges are very complex, and that's where implementation science struggles. And if you get insights from mixed methods research, then what we do is like we can show some effect, tighter, calibrate or whatever our instruments, and go deeper and generate socio-cultural insights. And not just socio-cultural insights, this helps in exploring what structural barriers exist, why health disparities occur, why some people are able to access care and others are deprived of. And at the policy level, if you're trying to evaluate a policy, what are the intended and unintended outcomes of implementing a policy? So these are very rich and exciting evidence that one gets when using mixed methods approaches. Now, the other element is for the core researcher who is interested in theory development. Now, mixed methods research provides the opportunity of developing theories and also refining them, validating, that is, testing them. So for a social science researcher, mixed methods research gives that opportunity of developing theories. And at the same time, one can also use mixed methods research to ensure community participation and engagement. That means we go into the community, we talk to the people, and in the process, people own up the entire study. So there's a lot of relevance coming up, and at the same time, a lot of ownership and simultaneously validation of the findings come up. And these are very important aspects of developing human-centered or patient-centered approaches. That again is a very recent realization to public health people that our interventions do not work unless they're patient-centric or client-centric. Now, if we use mixed methods evidence, that means numbers, tests, and findings in like reasoning, logical reasoning behind the results that we got in the quant. It helps in very effective communication. And that kind of communication really strikes a chord with policymakers. That means it becomes easier to communicate evidence and also translate it. Now, if you ask me as a researcher or our team as a research team, how do we do it at GRID? Like where all do we use mixed methods approaches? Broadly, and these are just examples. These examples are limited to the type of work that we do. At GRID, we do a bit of primary research, and also primary means understanding the community and its behaviors, and some part of health systems and policy research. So in community-based research, what we do is like and that's mostly from designing implementation packages and all. So there we use mixed methods approaches in community needs assessment, in understanding health behavior, in health seeking behavior patterns, and also when we are looking at health equity and disparities. So we want to stratify our community and other stakeholders and understand what are the different types of health behavioral patterns that eventually impact the outcome of the interventions that we do. And that also many times mixed methods research gives us new hypotheses to further test and extend our inquiry. Now, in the health policy and systems research realm, we use mixed methods approaches for program evaluation. So impact evaluation of different interventions. We use it for health services research. And that means health services means whether we are reaching the right people or not, in the right dosage or not. And of course, how do we develop or refine our programs based on the evidence that we get from this kind of mixed methods approaches. Of course, I have not mentioned about the health policy analysis, where mixed method research are sort of the must-have evidence. Now, though that was just an overview of mixed methods research usability, we'll be talking about the detailed advantages of mixed methods research approaches. That video may become a bit jargony. This was just an introductory video. I hope you liked it. Thank you so much.